Cancers of the urinary tract are associated with significant morbidity and mortality, with variations in their global prevalence. Hematuria, or the presence of blood in urine, is usually the earliest symptom and is a known predictor of cancer, and prompts referral of patients to secondary care. Data on the prevalence is, however, limited to single centers and small populations. Given the geographical variation of urological cancers, there are less reliable estimates of prevalence. Thus, in a large multi-center international study called Identify, conducted by the British Urology Researchers in Surgical Training or the BURST Collaborative Group, researchers evaluated disease prevalence in 10,896 patients across 26 countries who were suspected of having urinary tract cancer, either bladder, upper tract urothelial, renal, or prostate cancer. Prevalence was adjusted using 4 predetermined risk factors, namely type of hematuria, visible hematuria or non-visible hematuria, age, sex, and smoking, as well as for geographical effect. Of the enrolled patients, 65.4% were referred with visible hematuria, 28.9% with non-visible hematuria, while 5.64% of patients had no hematuria. The overall prevalence of urinary tract cancers in those with any type of hematuria was 28.2%, bladder cancer being the most prevalent, followed by the less common upper tract urothelial, renal, and prostate cancers. Furthermore, overall occurrence of the cancer was higher in patients with visible hematuria compared to those with non-visible hematuria. Notably, irrespective of the type of hematuria, a larger proportion of patients with cancer were male, older in age, and had a history of smoking. Overall, these findings suggest that adjustment for geographical variation and risk factors provides a more accurate and robust measure of cancer prevalence in patients suspected of having urinary tract cancers. Being the largest study of its kind across an international population, this study paves the way for better patient risk stratification and informs clinical guidelines towards an effective diagnosis pathway and treatment of urological cancers.